You can start.
Ana Solva. Good evening, everyone. I'm Thirumanthra, a final year medical student from Indra Medical College and Hospitals. I welcome you all to Medusane Forum. It gives me immense pleasure to introduce Medusane, a platform that has rapidly grown to become a trusted educational partner for medical students across India. Our mission is simple: to provide accessible, high quality educational resources that empower students to excel in their academic and professional journeys. We are proud to say we are a vibrant community of more than 25,000 YouTube subscribers. One thing I personally like about Medicine is it's a platform built for medicos by our very own fellow medicos. It functions on the principle Karpom Karpipom. We shall learn and we shall teach. After all, knowledge is a baton waiting to be passed if life is a relay race. Well, today's topic is mental health and breakdown strategies. Life is challenging. Things can be especially challenging these past few years. You aren't alone, even if it feels like it. Let's sort between the facts and fiction together. We have with us a very own founder and chairman of Medusane, Dr. Raghunandan Ramanathan. He's completed his MBBS in Tagore Medical College and Hospitals and currently working as a psychiatry resident at Amrita Institute of Medical Science, Kochi. Dr. Raghunandan stands as a beacon of inspiration leadership in the realm of medical education and community services. I take immense pleasure in welcoming you, sir. Sir, when it comes to mental health, why do you think exams trigger so much anxiety among students, especially in medical colleges?
Okay, so first of all, very good evening to all the students who have joined through this wonderful platform. So first and foremost, just we had our inauguration and we had a wonderful personality with us, Dr. J.S. Rajkumar sir. So starting from him, he is actually almost he has won 12, 13 gold medals in his your student's life. How do you think that he is actually gaining this much just because of his marks? Definitely not. Exams symbolize more than just marks. They represent the competence, career security, and self worth for many students. When you take in medical school, where competition is intense and expectations are very high. So you see, after completing your NEET UG, every one of you is actually a topper who is entering into medical school. But then anyone noticed after the first IA marks, most of us goes into depression because we had an expectation of 90%, 95% in our NEET UG, and all of a sudden we are dropping so much down. We are moving into 50%. We are just trying to pass in your anatomy exam. That is because of the high educational standards, as well as there is a shift between a school life and a professional medical college life. Students often tie their entire identity to perform. They always have their topper mindset and they come here, and this creates a performance anxiety, which is not just a psychological, but it is a biological one. The brain perceives exams as a threat. You find this exams as a triggering the fight or a flight response. And when it is becoming unmanageable, most of us, the pressure overwhelms our cognitive function, especially our memory and focus. And it is not about just the fear of failure, but it is fear of not being enough, not being competent, you yourself self-doubt. And this understanding about this marks are not going to be just representing your competence. The marks are just going to be the present status of yours, and there is always a scope to improve. And when you understand this, this is going to be the first step in healing. I get many messages, especially I conduct this RRR, rapid revision series, before your university exams. During that time, I get many messages from students and they tell, sir, I'm anxious. Sir, how am I going to cope up this? This is because you consider it as a threat. You should not consider the exams as a threat, but just a stepping stone for your next professional. No one is going to question you if after your, just imagine, after your professional MBBS exams, you come out as an intern, you come out as a doctor, sit in the as a general practitioner, or go to your NEET PG exams. I can promise you that the marks you scored in your university exam is nowhere going to be similar to that you score in your entrance exam. Entrance exam is completely different perspective. Similarly, these exam is not going to reflect your clinical skills after you come out of your MBBS. It is going to be your clinical training that is important. And I think most of you guys are missing this nowadays. And that is what I emphasize in medicine.
So, what are some common signs that a student is experiencing unhealthy level of exam stress?
Unhealthy levels of exam stress, if you're asking me, see, some level of stress is very common. Without stress, without a push, no one is going to go for preparations. Okay, no one is going to go for preparations. When it comes into unhealthy territory, students may experience some sleep problem. The students will be experiencing there is a reduction in the appetite. There will be a constant fatigue, irritability. So even for small things, you get irritable, and even sometimes people may get panic attack. I would like to recall my 12th standard exams when I was appearing for my revision exams, so mock exams, which the school conducts. I myself had this panic attack. So, and I also have still the panic before the exams, especially during my first year, second year. If you are gone and asked to all the faculties, those who are just taking in medicine, all those faculties are the one who trained me, and they will very well tell that now Raghu is talking about panic attack, who actually had it. So the reason is that time I always treated it as a threat. I always treated that the faculties are going to screw me when I enter into Viva. The time when I got into several motivational people in my life, gone through their life, then I realized mentally we become blank, we become unmotivated, we go into this loop of negative thoughts, whether I will pass or not, whether I'm going to fail. All these things, they are going to make us isolated. They are going to make us extremely emotional. And this is going to be the pattern where the people are going to experience this unhealthy level of exam stress. So what I wanted to tell you is, when you guys have these changes in you, when you're going to have a sleep problem, when you're going to have an appetite problem, when you're going to have a fatigueness, when you're going to have irritability, then I asked you one question, isn't it, in the group? So how many of you will be taking the professional help? Okay, how many of you will be willing to take a professional help? I think many of you like haven't taken or hesitating to take, or you don't know how to cope up when you're going to have all these procrastination, all this feeling of inadequacy, anxiety, panic. So I wanted to emphasize, I think upcoming questions are there from Thirumanthra also. So I will also discuss at the end some of the common things that people ask me. So kindly take a pause, just reflect yourself where you're going wrong. Stress is good for you to push you towards your success, motivation towards your success. But when it starts impairing you, take a break, take a pause. Taking a pause is not a problem. Taking a pause is not a wrong. I think most of you told you feel guilty when you're going to take a break, take 1 or 2 days break before your exams or during your professional life. But that break is going to bring you back to the originality. Okay, so that is what I want to tell you guys.
But how do we differentiate which is a normal healthy level of stress and which is the unhealthy level of mental concern wide stress?
Uh, Normal stress is a time limited and manageable. So it is just going to push you, but it does not paralyze you, basically. If you can still study, you can still sleep, you can still function. Some sort of nervousness will be there, but it is okay. It is okay to be nervous. But when that stress is going to break you down, when it is going to give you a chronic low mood, you feel that you're worthless, you're helpless. There is a loss of interest in things you enjoyed before. It could be an early sign of adjustment disorder or anxiety or a depression, whatever you call it. And another warning sign is students turn into unhealthy coping mechanisms, like they skip the meals. I've seen many students, those who are telling me, sir, I didn't even eat my lunch. I'm studying. I didn't even thought of other things. I just forgot my hobbies. I just forgot reading novels. I just forgot talking with my friends. I'm just concentrating in my studies, but still I couldn't. And rather, if you ask me, I can quote you one of my friend, he never studies. Okay. He never studies. He always enjoys. And sometimes I myself feel like he is enjoying in his life. What am I doing? But then at the end, he also scores well. I also score well. But what is the difference? The difference is the approach towards it. I approach it very seriously, and I approach it with a stress, lots of stress, that all my function gets reduced. He is relaxed. He is studying at his own pace. He doesn't compete with others. At the end of the day, he scores equal to me. That means it is not that you study hours of hours. It is the how much concentration you have without a stress, how much you are going to study. And many of you guys, we move into the other coping methods like substance use. At that point, stress has tipped into a clinical issue, and definitely you guys need a support if you are in that stage.
Sir, I'm just curious to know, can you walk us through what happens in the brain during stress or panic before exams?
Sure. During stress, actually, you have something called as amygdala, the brain's alarm center, as we call it as. So it is an emotional center. It gets activated. It tells your body that there is a danger. Even if the danger is just a test, when you're going to treat that test or the exam as a threat, your amygdala tells it as a danger. This triggers the hypothalamus to release all the cortisol, the stress hormone, and this is going to affect your memory, it is going to affect your attention, it is going to affect your gastrointestinal tract and whatnot. At the same time, the prefrontal cortex, your decision maker, it is going to get hijacked. And that's why you forget what you learned or you feel paralyzed, isn't it? Have you ever noticed you are well prepared at the morning before your exams? You will be well prepared. You will be going and sitting in the line in front of the Viva examiner, and you enter into the Viva examination room. Till that, you will be like confident enough. But you will have that stress. Ayo, will I be able to cope up? Will I be able to answer? And at the end, what happens? Your amygdala treats it as a stress, treats it as a danger, and it triggers hypothalamus to release cortisol, and that is going to affect your memory, it is going to affect your attention, and it is going to cause the prefrontal cortex to stop. That is why you may forget whatever you studied. The good news is, with the technique like deep breathing and mindfulness, there is something called as JPMR. I think every one of you, it is not just the patient who has to do this. Okay, this we deal in psychiatry. We ask the patient to do this whenever the patient is going to be very stressed. But it is not just the patient who has to do that, but it is every single person can do it. So it is called a Jacobson progressive muscle relaxation technique. There are lots of techniques that the JPMR muscle relaxation gives you, and this is going to promote relaxation and reduce stress. So today, what I tell you is, before your exam, I'll share the link in the group. Okay. Before the exam, what you guys are going to try is just let it be a IA, let it be a small exam, but try this. It is just a 10 minutes exercise, 10 minutes breathing exercise. You're going to relax every part of your muscle, every part of your body. And that is going to give numerous of benefits, not just mentally, but physically also. And regular practice of JPMR is going to reduce anxiety, improve sleep quality, and also it is going to overall give you a beautiful results. And this is the point take home. First point to take home today's session is you guys going to go through what is JPMR, and I'll send you the entire JPMR strategies, like what are the exercise, what are the things you need to do, and that is going to help you to control your anxiety, and it is going to enhance your performance in your exams.
Sir, could you give us more, again, like 2 to 3 quick practical techniques students can use to manage their stress immediately?
Yeah. So this is very important again, I guess. So you're sitting inside the Viva examination, and you feel like, oh, what I'm going to do now? I forgot everything, what to do. So I want to recall during my first year, I guess, during my first year, literally, like, I am a very good student. I am a very good learner of biochemistry. That is my favorite subject, I can tell. I think most of you will be like laughing, sir, biochemistry pathways. What is the thing to enjoy in that? Yes, there are lots of things to enjoy, and I enjoyed completely. But then, like every one of you, I also had this anxiety. I sat in front of my examiner. There usually like a one internal and one external examiner was there, and that external examiner is from a very famous government college, and my internal examiner is my professor. And I think I can tell his name also. He has taken in this channel also, Dr. Desigamani. He is a fantastic biochemist, and more than the fantastic biochemist, he is a fantastic human being, a fantastic encouragement for me in my life. And he just told me when I sat in front of him, there are some simple questions. I don't think even it is a complicated question. It is very simple question, and I was unable to answer it. I was literally blank, like every one of you message me usually before your exams. I am also literally blank that day. That was my first exam, biochemistry. University Viva was my first Viva exam that happened immediately after my university exam. And I was like blank. I don't know what to do. Okay, simple thing what he taught me usually is just breathe. Just inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds. So this is going to actually slow your heart rate and calm your brain. Second is some grounding method. So name 5 things you're going to see around you, 4 things you can touch, 3 things you can hear, and 2 things that you can smell, and 1 you can taste. So just remember. So these are the 2 techniques which I follow. One is box technique. Box breathing is nothing but you're going to just follow this 4-4-4. 4 seconds you're going to inhale, and 4 seconds you're going to exhale, and again for 4 seconds you're going to hold without doing anything, and this is going to come under repeat scale for 1 to 2 cycles. That is going to help you. Second thing is, as I told you, grounding technique. So this is nothing but you're going to get distracted from the stress which you have. So 5-4-3-2-1 strategy. 5-4-3-2-1 strategy. What is this 5-4-3-2-1? 5, the things that you're going to see around. 4, something you can touch. 3, something you can hear. And 2 things that you can smell, and 1 thing you can taste. All this are going to bring back from the stress to the present situation. And third is time blocking. Okay, so always when you study, you have this, right? So you're going to study for, you will be planning for a long revision schedules. So from the day 9 o'clock in the day to evening 5 o'clock at the night during your examination, study leaves. I think majority of you do like me. I am not a very unique person at all. I am also like very common like you. I also like very stupidly plan my timetables. Okay, that time we will be like stressed. So morning I'm going to do, so I didn't complete 50 pages, 50 pages, 50 pages. We'll be running behind the pages, isn't it? So what I tell you is divide your study time. 45 minutes, focus. 10 minutes, take a break. This improves efficiency as well as burnout. Don't forget, get hydrated a lot and do some stretch exercises. That is going to help you.
Sir, how important is routine sleep and diet in maintaining good mental health during exams?
Yeah, this is one thing I wanted to address next. Okay, so sleep, routine, and diet. These 3 things are very, very important because they are the foundational. Sleep is when your brain consolidates memory. You study a lot, you study pages of pages, and you go back. You sleep just 2 hours, 3 hours, then wake back again, study, study, study. What it is going to do? Because your brain is not going to consolidate it. You have to turn your recent memories into a remote memory. There is a popular saying in Tamil. I think majority of you guys, in some part of your life, your faculty would have told, if I wake up from your sleep also, you should tell this. This one common line every faculty tell, isn't it? But if you are not sleeping, how will your brain accommodate all the things which you have read? Studying without sleep is like a file without hitting save button. You're going to type everything. I'm going to make a presentation, 50, 60 pages of presentation, and I'm not going to save it. What will happen? It is going to just get destroyed. Again, you need to start from first. And that is the first thing that majority of students like me, like you, like everyone does. Second is a poor diet, especially skipping your meals, or when you're going to read a lot, you just have Lay's packet, you just have all those junk foods with you. You start to binge eating, and binge eating is going to affect your mood. It is going to affect your energy. And at the end, it is going to confuse the entire body clock, and it is going to increase your anxiety. Even just 15-30 minutes of regular light exercise and a consistent sleep wake cycle and eating a protein rich diet, a complex carbohydrate meal can boost the mental clarity and stabilize the mood. Think of your body as a hard drive. If it is going to crash, no app will run it. Okay, no app is going to run it. And make sure that your brain, your body is not going to crash. If an app crashes, what will happen? You have to reinstall it. You have to reinstall it. It is going to use further data. It is going to be worse. So make sure that your exam strategies are going to run without getting crashed. For that, routine sleep wake cycle, your consistent exercise, and eating protein rich food and complex carbohydrate is necessary.
Sir, how do you think social comparison and peer pressure impact exam preparation stress?
Definitely, Ma, definitely. That is one of the important factors. I think I am asked in the group also. Do you compare your performance with others often? I think 37 to 40 people have mentioned sometimes, and 12 people honestly mentioned it as all the time. I will not say that only 37, only 12 people are having this performance comparison. All the people, those who are attending this webinar, will be comparing with your friends, my friends. So there is one of the famous scene from Three Idiots or in Nanban in Tamil or whatever dubbing movie it is. In Three Idiots, if you see, the hero will be like scoring top rank, and the friends will be like scoring in the bottom. And at the end, the both of them after the results, they'll be telling that even we getting the last rank is not bothering us, but my friend gets the second top rank is bothering me, first top rank is bothering me, because he is also sitting with me, I am also sitting with him. Where is the difference? The difference is he is performing it without performance anxiety, he is performing it without any comparison, and we are running behind like a race. So that is entirely what that movie also says. Okay, a lot. Okay, thanks to the social media and competitive environment, students often feel like everyone else is ahead. Everyone else is ahead. We all think that, you all are studying, but we don't know what they are literally studying. So you can't compare yourself with others. Maybe they are studying for the first time, you are studying for the third or fourth time. The truth is, people only show their highlights, but never the struggles. If you go back, you can just go to the random websites, NEET PG topper. I actually hate this concept of interviews. That is why we never do any interviews. Even though we get lots of messages from students when they are going to pass, they got distinction, honors, everything they message me. But this testimonials and this interviews, I personally don't like it, because they are highlighting only the success. They would have struggled a lot. But that will be exaggerated, or you don't know from what situation they are in. Everyone has a different situation in their life. You may have different situation, I may have different situation. So constant comparison is going to create only pressure, it is going to create anxiety, and sometimes even resentment or inferiority. The focus should shift from, am I doing this better than others, adilande we need focus that, am I doing better than yesterday. Remember, everyone's timeline is different, guys. Use others progress as inspiration, not as a measure of your worth. Use others progress as a guidance, not as your perfect plan. Each one should have different plan. Each one should have different plan of action. Your plan of action is going to help you to succeed, not others, because the present situation with which the other person has prepared this plan is completely different than your present situation. Okay, so that is my piece of advice for you guys.
Sir, like you said, like even if we follow, we have like our own set of plans, but we feel like we tend to fall back, like we are not coping up. So, what to do?
Okay, so I think I need to tell my own story also here, I guess. See, I am not a great topper in NEET UG. I got one of the self-financing colleges, which is not like top ranked in the state and all, but one of the pretty decent one. Every medical college has some sort of very good faculty, some sort of faculty who doesn't interact with you. You need not mind about it. Every college will definitely have one, at least one faculty who is going to be student friendly, who is going to help you at any situation. Find them. Okay, find them. Second thing is, my NEET PG preparation. My NEET UG preparation haven't yielded. In my NEET UG preparation was very fast. Mine was the first batch who came into the NEET UG. I was the first one who wrote the NEET UG. I got only a self-financing college. I joined over there. But till today, I never regretted that why I have got that college, because that was the only availability for me. But I tried to utilize the maximum which is available as a resource over there. I might compare myself. MMC students are getting so much of cases. KMC students are getting so much of cases. My college doesn't get it. But it is you who is going to be responsible for utilizing whatever opportunities that your college has. My college gave me the liberty to try everything in my life. I have been the person who went to every competition in every medical college. I'll be standing there. Initially, I have failed a lot. I have failed a lot. And in my internship, during my final year internship, whenever I step into a competition, I win the prize and come. Be it a research paper presentation, be it a case presentation, I determined to win and come. That is because my college gave me that opportunity and I asked for that opportunity. I was not sitting that this college doesn't have any good opportunity like MMC, KMC, and other medical colleges. I didn't think about that. Same way in NEET PG, you will not believe my NEET PG score is not so good to give an interview. So to boost everyone, to inspire everyone. Mine is a normal NEET PG score. But I was possible, my score was possible to get some good college, a good private medical college, one of the fantastic medical college. I can vouch that my department is very good than any other medical college, even some of the government peripheral medical college in Tamil Nadu. I can vouch because I have been seeing my friends studying in psychiatry in government medical colleges, in peripheral medical colleges, than them. My college, my department has more number of cases and more number of opportunities. So it is not that if you don't get a private medical college, if you're going to get a private medical college, you're not getting a government medical college, that is not going to be the end. So each one has different ambitions, different stage. So never compare yourself with other person. That is the first thing I want to tell. Second thing is never compare today's position with tomorrow's position. Every day you can improve in your life. Why I'm telling you is I scored. I didn't. I can tell you honestly that the May 2024 INICET exam, I haven't qualified. I haven't qualified. I can tell that honestly. Next 2 months, I determined I need to get within a rank that I am going to get psychiatry in a very good institute, be it a government or be it a private. I want to get into one of the fantastic institutes. And I had Manipal and I had Amrita as a only two private medical colleges I had in my choice, and other things I had in the government. And fortunately, if I had waited till round three, I would have got even a government medical college in a peripheral setup in Tamil Nadu. But I haven't waited for it because I felt this institute is best compared to others. Same way, everyone's priority differs. So don't expect that everyone has to be topper to be successful in your life. It is not so. Okay. And second thing, I'm coming back to your question. When you're going to feel like going behind, not coping up, first accept that you are not alone. Okay. There are many people who are common like you. Second, pause and reframe your strategy. Instead of thinking that I am behind, where I'm going to restart, what I'm going to do. This was my thinking till April. Till I think like April end in the 2024 when I was appearing for my NEET PG exam. In May 2024, when I failed to qualify in my INICET, my mother told only one thing: in your parents are the greatest support for you guys. Believe me or not, your parents are going to be the greatest support for you guys. I was like unsure where I'm going to go through, how I'm going to restart. Then she told me, don't aim for so things. Aim like small things in your life, and ultimately your goal has to be to reach one of the fantastic institute in the country in psychiatry. That is my dream. So don't just stress yourself every day, 70 pages, 80 pages. That is not that. Identify small achievable goals. Keep your goals achievable. You know, you can self-realize, you can self-evaluate that the goal is achievable in the stipulated time, and celebrate each and every progress. Talk to your peers, talk to your mentors, counselors. Even one honest conversation can reduce the emotional burden. Lastly, avoid perfectionism. It's okay to get some things wrong in your life. Falling behind is not the end, it is just a detour. You can bounce back very easily, believe me.
Sir, having said this, are there any red flags when a student must seek professional help?
Yeah, I think I have covered this already. Once again, I'm telling. Okay, you are, everyone faces stress in our life. Okay, I'm saying every day. It is a very tough situation that in a psychiatry department, when you're going to sit, you see lots of MBBS students coming here with death wishes, with suicidal ideas, with hopeless, with anxiety before their exam, with self-harm attempts. See, when you guys are going to a prolonged sadness, you don't know what to do in your life. If you are not able to concentrate in your life, you're going to take a page. You're trained to read, but you're not able to read. It's okay. Just be relaxed. But if this is persisting more than 1 week, 2 weeks, you are hopeless about your entire examination. You're going, if the anxiety is going to interfere with your day-to-day functioning, and if you're going to have a thoughts of self-harm or suicide, take emergency help. These are the red flag signs. If you're going to have excessive withdrawal, suddenly there are one of my friend, I don't want to name them, they suddenly withdrawn from everyone because they didn't qualify in the NEET PG exam. Definitely excessive withdrawal from everyone. Excessive withdrawal from everyone. Break you can take, but if you're going to be excessively withdrawn, leave all your pleasures in your life. That is going to add on your stress, and ultimately that you're going to suffer. Okay, burnout if you're going to feel. If you're going to feel that there is some drastic behavioral changes, seek help. If stress starts to feel like suffering, help should not be delayed. Remember, asking for help is not weakness, it is wisdom. Psychiatry isn't about the crazy people, as many people think. It is about healing minds and restoring functions. Seek help in your respective colleges with your psychiatrist. It is not at all wrong. Take psychology counseling, help. So every one of us have different personality, guys. My friend and I have different personality. You cannot compare me and him. He might be having a cluster B personality, a kind of very emotional, very kind of very strict, who can be impulsive. And there are few people who are very anxious, who are very avoidant, who are very dependable. And there are few people who are going to be like paranoid people who doesn't bother about anything. So each people have different personality. Don't compare yourself with others. And if you feel that you are not functioning well, seek help. That is the only thing I would like to tell.
Sir, I'm sure you have told us enough number of stories, but can you share a personal story or a clinical experience that gives hope to the stressed students?
I can tell you two things. Okay, once a friend who nearly dropped out in a final year due to some crippling anxiety or something. He felt numb. He couldn't focus. He cries often. Finally, he opened up. Actually, he received counseling and made some lifestyle changes like routine, mindful breaks, some journaling, and something. These transformation may appear like slow, but it is real. Today, he is a confident doctor. Okay, and just take me. I can proudly tell that in this session that the person who changed my entire life is Dr. Balaji Armugam, sir. He is a professor and at the Department of Community Medicine now in Arunai Medical College in Tamil Nadu. And this particular faculty, why I name in every session is today I am speaking confident in front of you. That is because of him. So I am a person who has some excessive anxiety in my life. I don't have that confidence initially. Initially, if you go back in my second year and all, I was not a confident person like I am now. Okay, so when I went to the is posting community medicine posting in community medicine posting, our sir alone, he gives variety of activities rather than just reading the PSM. He gives variety of activities, and one of the activities in that is to speak in front of the audience about some topic he gives, and it is going to be like a kind of giving a speech. He accesses every single point in that, whether your volume is good, whether your attitude towards the audience is good, whether you are having any action, everything he accesses. And that one person gave me so many tips that I transformed into the person I am today. And second thing, my friends. So just remember, guys, three people who can change your entire life. One is your friends, one is your family, and one is your faculty. All three, I'm not going to keep them in a different arena, a different place. All three are going to be equal. A true friend is going to be helpful for you to transform completely and become one of the greatest and one of the good communicator, one of the good transformer in your life. Second thing is your faculties. And third thing is your friends and your family. All these three are going to change your entire life. Same way in my life also, my family is one of my support and my friends are the other support. In third year, so I always have this traits called dependent traits. If some people can go and read the DSM-5 criteria, I always feel that I match this dependent traits. What is this? You're always feeling emotionally dependent, always want some reassurance in your life. I have this habit. Whenever I'm going to do something, I reassure myself and I get reassurance from my friends. And these friends are very supportive to me. There are five friends in my life who actually I discuss everything in my life. But these five are confidential persons that they don't share it with anyone. Find people like that in your life. These people are going to transform your life, can be a very good coping up mechanism, where can be a very good coping up persons in your life for coming out of this anxiety, depression, all these things. Okay, so find them and cry to them. No worries. Okay, cry to them. tell all sort of things to them, but they can give you at the end a honest feedback. If you're wrong, they will tell you as wrong. If they are right, if you're right, they will tell you as right. Take them as a feedback in your life, and you can transform very good. And to this point also, even now, I have some of the confidential people who is going to help me out. New people I select. And here, of course, even in Amrita, when I joined as a resident, even everyone, like I also had adjustment disorder. I also have very difficulty to adjust in this new place, new environment, new culture, new food. But then I selected people who are very confidential to me, who are comfortable to me, who can understand my situation. Find them. They are going to help you in your life. Here I have my senior who helped me a lot. Here I have my friends from other departments. I have so many friends from other departments who actually call me with just a look that I'm not good. If they see that I am not looking good, I'm looking dull, they call me. They ask me, what is the problem? How are you? This one single thing helped me a lot to come out of the stress. Same way, every one of you can have some of your confident friends, family, and your faculties. Select them, cry to them, but at the end of the day, cry should be just for 5 minutes, not more than that. You should find the solution for it. Once you find the solution, you will not have all those overthinking. You will find lies fix in your life, and you can succeed in your life.
Recently, I've come across this very common word, work life balance. What is work life balance? In medicos, can they have work life balance?
So this question, I think medicos have work-life balance, but residents don't have work-life balance. Okay, so that I will tell. So now basically people think when I am in final year, I'll be thinking, oh, when will I go as a PG, sit there? But then when I become PG, I'm thinking, why did I take the PG so fast? I could have enjoyed some sort of my life. So jokes apart, residentship is some let it be residency or post residency, it is going to be tougher in your life. It is going to be tougher compared to other graduates, be it engineers, be it anyone else. We have 24 into 7 duty. Then I call it as a duty, I call it as a responsibility. For example, there was a patient of mine. Okay, there was a patient of mine who had a seizures. Okay, who had a seizures at the morning, 6 o'clock. What happens when you are not picking the call? When you're not picking the call, you are responsible for that patient, isn't it? You can't say that I am sleeping, I could not pick the call. Those sort of things we cannot say in your profession. So work life balance is screwed the moment you take MBBS, the moment you decide to become doctor. But then, as I told you earlier, like how exams should not be considered as a stress, similarly your work should not be considered as a stress. Start enjoying your work. Nevertheless, more than 8 hours, 9 hours of work is going to affect your sleep cycle. It is going to affect your relationships. It is going to affect your family life. Just make sure that it doesn't affect all these arenas. Okay, make sure that you are responsible. At the same time, you spend time with your friends, you spend time with your family, you spend time with your all the other hobbies also in your life. See this today, if you're going to say I am sitting still in my PG room, still in my OPD, still I have a work, but then I have the passion towards this. So I accepted immediately when my teammates asked me, sir, why don't you do this? They asked me, and I immediately accepted it because, yes, fine. I see, there is one saying in Tamil. Okay, it is not meant that I have learned everything. Someone taught me everything, all about all these issues. When I'm going to speak to you guys about anxiety, about depression, it doesn't mean that I know everything. It is because I have experienced from your legs and I have understood that these stress are nothing when you move ahead in your life. Everywhere you're going to have stress, every moment you're going to have stress, and we are not sure when you are going to get caught in all this. So, my dear friends, what I tell you is work life balance is a hypothetical one. You find balance among yourself. My work life balance will not be same as your work life balance. The same similar way I told my performance will not be similar to your performance. So my radiology friends who are in the college, they are completing their work at 5 o'clock. ENT psychiatry completes at 7 o'clock. And there are my friends from general medicine and general surgery who completes their work at 10 o'clock, 11 o'clock, and 12 o'clock. Okay, there are my ortho friends in Sri Ramachandra Medical College where they complete their work at 2 o'clock at night. Even if I want to meet him when I go to Chennai, I could meet him only at 2 o'clock at night, not earlier than that. That means work life is going to be changing with different people, and where it is going to affect you is if you are not enjoying it, if it is not going to give you a sense of satisfaction, when you feel it as a overburden in your life, take a break. Tell them that you need a break. Tell your co-PGs, tell your co-friends, tell your faculties, sir, I am overwhelmed. Try to create that. Okay, and I think IMA as well as many professional bodies are trying to bring some sort of time constraints, a frame for the student, for the PGs, and for the faculties who work in medical colleges. Nevertheless, even if they bring it in rules, I don't think so. It is going to be made applicable everywhere. But the thing is, if you feel stressed, take a professional help. Number one. Number two, start enjoying your work. I'm not saying enjoy the 24 hours duty. 24 hours duty is literally screwing everyone. But then, even if you're forced to do that 24 hours duty, at the end of the day, you have chosen this field and you are a professional who is responsible for your patients, from your people. Okay, so keep aside all those stress in you. Never, ever, ever make that stress transformed into your patients. Only then you are going to become a successful doctor. Number one. And number two, I think this also I wanted to highlight. While taking a college in the PG and coach PG counseling, we will be seeing which college has very good patient load. Once I come here, once I sit as a resident, I'll be feeling, oh, why the patient got admitted today? I have so much of work to do today. So this is going to change our thinking. Our attitude changes every day. That doesn't mean that you are going to be failure in your life because of your poor work-life balance. Try to cope up. Try to cope up in your life with something which are available. Try to resist. Try to resist if you are not feeling well. I'm not saying that just work for 24 into 7. No, there is a healthy working lifestyle. Follow that healthy working lifestyle. Ensure that you go through that. And moreover, as I already told you, your amygdala should not think it as a stress, should not think it as a they think it as a fight. It should not think it as some burden. Once it starts thinking as a burden, once it starts thinking as a threat, it is going to affect your entire system, entire body. So make sure that doesn't happen.
Thank you. Thank you, Dr. Raghunandan, our very own founder of Medicine, for giving your valuable time and enlightening us. I'm sure
So
all of us.
before completing Thirumanthra, I just want to tell one thing to everyone. See, we have something called as this cycle. So anxiety starts from a small root cause. It goes into thought. This thought transforms into reaction, and that is the one that is going to transform into the behavior. So instead of whenever our mind thinks like, I'm not prepared for this, whenever you think that I'm not prepared for that, as I already told you, follow this 5 4 3 2 1 strategy. And when you feel like others are ahead in your life, just go back, take a paper, try to analyze what you achieved in your life. Take other people as inspiration to follow their footsteps, but not as a competitors. And whenever you think, so you gone, I forgot everything, I forgot all the things I read in my life, all the things I read in the last 1 year, take a break, go for a walk, return with some calm mind, and that will help you. Similarly, 5 tools, remember, that is going to beat your exam stress. One is breathing exercise. Number two, steady sprint. Take 45 minutes, take 30 minutes, 15 minutes break. 45 minutes, 15 minutes break. And very important is avoid doom scrolling. So just don't go on referring books after the books. At the end of the day, you don't read nothing. Leave out this fear of missing out. Other people would have read from Ramdas Naik. You would have read from Robbins. Other person would have read from Arshvardhan, Arshmohan. Let it be. At the end of the day, concepts in pathology is going to remain the same. Whichever book you are going to read. So don't like, oh, this guy is reading some easy book and I didn't read it. This guy is reading tough book, I didn't read it. Never go like that. And remember, journal the entire thing. Whatever you have done in your life, journal on everyday basis, and then see what can be an improvement on yourself. Don't compare with others, compare with yourself. And finally, speak up your problems. There are lots of people there who are ready to listen to you, and that is the main reason why I started Medusane platform. WhatsApp groups have all the faculties who are with you in the same group. Put out your problems in the group, or put out your problems to me alone in my chat box. I'll be there to help you. There is no monetary, nothing. This is just a help for you guys, for the upcoming generations of medical students who are going to be. Just imagine, guys, your father, your mother is going to go to a doctor in the next 20 years with your colleagues. You may be orthopedician. My parents may come to you. I may be a surgeon. I may be a psychiatrist. Your parents are going to come to me. So we are going to live as a society where every one of our relatives is going to go to this generation doctors. If this generation doctors are not going to come up with a good clinical skill, with a poor mental health, what is going to be the future of our country? What is going to be the future of our country? We don't know what is going to happen tomorrow. Why we need to get anxious? Yesterday, we had a patient who had a severe depression, like adjustment disorder kind of, not a depression per se, adjustment disorder kind of. My consultant, my faculty was seeing her, and I was the one who took the case presented, and ma'am was seeing that case. Ma'am told a simple thing, tomorrow we don't know whether we are going to be in the war zone or not. Tomorrow we don't know whether we are going to live or not. So why not we enjoy the present situation? Why not we enjoy whatever we read? Why not we enjoy whatever we do in our life? That is going to help you guys. And thank you, Thirumanthra, for such a wonderful questions. Definitely, we are going to launch a medicine mentorship portal, revised, refined, and reinforced by Dr. Raghu. And this is going to be launched very soon. And it is going to offer personalized mentorship, doubt solving, and motivational guidance, where I'll be sitting every alternate days with you guys in the Zoom. And this is going to be one of the fantastic thing for the undergraduate medical students, which I have planned. And sooner, all your WhatsApp groups will be it with the message and the poster for the same. Okay, I would like to thank Thirumanthra and the entire medicine team, which is working day and night for this conference. Let it be successful. Thank you.
Thank you. Thank you, sir. Thank you, sir. I'm sure all of us would have enjoyed this session and learned a lot from this. Remember, face your fears, don't fall for them, don't fail because of them. Stay tuned for our upcoming session on Breaking the Bad News by Dr. Niranjan Karthik at 8 p.m. See you all there. Thank you.